Well, in today's Frontline Diaries segment, we connect with Dr. Francis Bakewell, ER Dr. Francis Bakewell. How nerve-wracking was that emergency room in the early days, Doctor?
Well, it was certainly the most unique thing I've experienced in my career so far. As emergency room physicians and nurses and the whole team here, we're usually prepared as much as we can be for anything that comes through the door. But I don't think any of us obviously were ready for what happened in the middle of March.
Obviously, a lot of changes. One of them, everyone had to put on that personal protective equipment, just a new level of stress in the room around that. I imagine it's now strange to see people without it in the hospital.
Yeah, I honestly, the joke is that we kind of forget what some of our colleagues look like from the nose down these days. It's so unusual and jarring to see somebody without it. The particular stress with us is not knowing what's coming in the door. You have to be prepared for every patient potentially having an infection.
And I think we were worried for you as we were watching from afar and seeing what was happening down in the States, where there were some issues with supply of that PPE, where we were seeing hospital ERs overwhelmed, intensive care units overwhelmed. The hospital here, though, the Ottawa Hospital, was never in that situation. What went right here to prevent that from happening?
Well, I mean, I'd like to say, obviously, that we had a huge part in it, but I think that overall, I think our public health experts helped prepare all of us as a city, as a society, to be ready for the worst. But thankfully, I think the measures that were taken helped prevent the spread of coronavirus so far from being as bad as we saw in some of those other places. Obviously, in our field, we were seeing colleagues down there, many of whom we know and overseas in Europe as well. And the barrage, the onslaught that they were facing, and we were ready for that, and I think still remain ready for that, but obviously have been lucky so far that it hasn't hit quite that hard.
You say so far a couple of times. What's the concern level around the hospital about a possible second surge here?
I mean, it's hard to say. It's our job to be concerned and it's our job to be prepared. I think that so far we've been doing a tremendous job as a city and in keeping infection levels low. Obviously, as things open up, as we're seeing more interactions, larger groups, we hope for the best, but prepare for the worst. It's kind of the nature of our job.
Has it been a time where you've really felt the support from those that you work alongside?
Yeah, absolutely. Seeing our, emerge nurses, our respiratory therapists, our ECG techs, our clerks, everyone, all of whom are tough as nails and prepared at the best of times, seeing them deal with this new added level of stress, but maintain their composure, maintain their good humor, and most of all, their desire to help has been really inspiring for me.
If I was an ER doctor, I think I'd be tempted just to run away from it all. It's probably a good thing that I'm not. But for you, running has actually been something that's kind of helped you remain sane while you're in the thick of it all.
Yeah, I mean, outside of work, there hasn't been a whole lot more to do, to be honest, obviously, as everything's been closed down. But getting a chance to get outside, breathe some fresh air, get some sunlight has really been an important respite for me from my work here in the Emerge.
Making sure you're ready for whatever is yet to come.
That's right.
All right, Dr. Francis Bakewell, emergency room doctor at the Ottawa Hospital. Thanks so much. Best of luck to you going forward.
Thank you very much.